I'm Jana Rosso. I'm one of the pediatric nurse practitioners here that works at Alive and Well. And I have been practicing functional medicine for quite some time, a little over a decade now. And so my patient population tends to be a lot of children with autism, PANS, PANDAS, various learning disabilities, but also a lot of other things like eczema and chronic gut issues, and just some oddities, some weird autoimmune disorders that people might not know what to do with, or they don't know where to go. And so they end up finding their way over to functional med, which is so special. And then our job is to find answers and hopefully get them feeling better. So today we're going to talk about how the microbiome impacts autism and how important it is to think about and look at that gut-brain connection. So here are this is our agenda. We're going to talk about autism. We're going to talk about some common clinical microbiome findings that we see in autism. We will touch on dietary preferences and what that can do and how that can impact your gut and your behavior. And then we're going to talk a little bit about how to start that journey to clean up the microbiome. And these are things that you can do even if you're not working with a functional practitioner. So hopefully that will help people today that aren't plugged in with a practitioner. Okay, so autism overview. I think we're all aware that autism has really skyrocketed. I don't think this is news for anyone, but I think it's eye-opening to put it on paper. Even for me as a clinician, as I was making these slides, I said, gosh, this is really wild. You know, back in the 70s, there was only 1 out of 10,000 kiddos or adolescents were diagnosed with autism. And then 20 years later, it was 1 out of 250. And then we have come so far. Obviously, we have new tools, we have new diagnoses, new clinicians that understand autism better and how to diagnose it. But the rate is just alarming at this point. So 1 in 36 is where we're at now. And I bet it's even higher than that. We might find out, moving along in the next 5 or 10 years. Boys tend to be diagnosed more than girls. And unfortunately, this is still often treated as a behavioral disorder. And the pathway for parents and for families is often, well, here's this diagnosis for your child. They meet the collection of symptoms according to the ICD or DSM, and we are going to encourage you to try ABA therapy and possibly medications if needed, or go see neurology. But there's often a lack of knowledge in regard to the other factors that could be contributing to the way this child is feeling or behaving. And I think some of that is because they can't tell us. A lot of children are non-speaking, so they can't verbalize, here's how I'm feeling, here's where I'm hurting. But some of it is just the lack of knowledge and the fact that we don't have a ton of research to back all of it up, right? So contributing factors, there is often increase for risk of autism if parents are older at the time of conception. Of course, the prenatal exposure to pollutants and pesticides, those are very well documented. They're also seeing that maternal obesity, diabetes, or immune system disorders, including autoimmune disorders, can contribute to the diagnoses. Low birth weight, and then of course any kind of birth trauma that is leading to deoxygenation or brain damage could end up leading to a diagnosis of autism. So I thought a lot of this literature was really fascinating. They looked at mothers living near freeways and traffic-related pollution, and they saw that these children were twice as likely to develop autism. Of course, there can be a genetic component. I don't think that's at play with every child, but a gene called MET, and then combined with the high levels of exposure to air pollution. Fever during pregnancy is also associated, and we're finding more and more information out about the use of Tylenol. And so hopefully there's more research coming, and I know they're studying contaminants, BPA, phthalates, fire retardants, a lot of chemicals that we're finding now in plastics, in our cookware, in our water. And so we are seeing that this really impacts early brain development and can play a role in that autism diagnoses. So what are some traits that we're seeing with autism and also with GI symptoms? So some of the most common autism traits include non-speaking, nonverbal. These children tend to stim or have repetitive behaviors. They often have issues or complications with social cues and social settings. There can be anxiety around other individuals. There can be learning issues. But on the flip side of that, we can also have very high IQ, very intelligent children. So not every child presents the same way, and definitely not every child that I see presents the same way. But one thing that is very common is that these children present with GI symptoms in addition to the symptoms of autism that they've been diagnosed with that disorder. So gas, bloating, abdominal pain, diarrhea, constipation, floating poop, food in poop. I often have parents tell me that the poop is just stinky or that their child is really gassy. And so I see a lot of this, and there's definitely that connection, the gut-brain connection, where we're seeing behavior and autistic symptoms increase with GI symptom increase. There was a study in 2015 that shows that there's an overlap between autism and GI disorders, and it can be helpful at identifying that if you see that there's a worsening of nonverbal behaviors. And these can include agitation, anxiety, aggression, self-injury. I see a lot of head banging, head hitting, leaning over the table, trying to alleviate abdominal pain and pressure, waking up at night, or sleep deprivation. So this should alert professionals that there is a possibility that there are GI issues alongside the child's autism diagnosis. We can't just equate this to a behavior problem. Okay, so changes in the microbiome. Why do these changes happen? Why do we see such prominence with GI symptoms? And this isn't only in autism. I would say that these descriptions here allow for changes in all children's microbiome and can lead to problems down the road. So we know that at vaginal birth, you're going to be inoculated with mom's flora, and that could be healthy flora. It could be a mix of candida and bad bacteria, but it's more of a natural inoculation. Whereas when we're born via C-section, we have more of a sterile birth. We're not going through the vaginal canal, and so we're not being inoculated with the normal robust amounts of microbiome that we will see in that vaginal birth. And there are a lot of OB-GYNs who are moving to the practice of using sterile Q-tips and getting mom's vaginal flora, inoculating that in babies so that we can see more of this healthy microbiome. And that might sound really wild to some of you who are on here, but that is what we're seeing, that if we have more of this vaginal birth inoculation of microbiome, different bacteria, we're going to see a healthier baby. And that can be true of breastfed versus formula-fed infants as well. Are they getting colostrum initially? Are they, immediately put on formula? So we can see differences in their microbiome with the feeding patterns. If they're given antibiotics before they're 1, that can really change the microbial composition and can initiate more negative flora being grown. Oftentimes with children who are needing antibiotics before 1 or 2 years of age, they're often needing more than 1 antibiotic. They might have recurrence of ear infections, and so they're kind of needing repeated antibiotics. And then we might really need to do an abundance of gut work at that point. And that leads into chronic infections below. And then diet, of course, the first foods we're introduced to, that's going to determine what we feed in our gut, what bacteria are growing, what's being fed and nourished. So these are all important in how our microbiome is diverse and how it's flourishing. So what do we see in autism specifically? I do a lot of stool studies, and I know that's gross to collect. I've done it on my own children. It's probably the grossest thing I've had to do, but it just gives us this vast amount of knowledge about what is in this child's gut. How can we help them? We can always guess, but that is frustrating. That can be really frustrating on parents if we're guessing, if we're trying different antimicrobials, or we're thinking, well, this might be yeast. Let's try these herbs. And so why not just test? We don't need to guess. And we have the testing now. So here are some things that we're seeing prominent: yeast and candida. And in my patients who are more hyperactive, they're laughing, they're stimming, they don't want to go to bed, they're just really happy-go-lucky, but it seems abnormal. They often have yeast or candida overgrowth. We see on testing a lot of low elastase, and this is pancreatic elastase that is utilized to break down food and help us digest. And this can result in poor absorption of our foods, poor weight gain, poor growth, and then abnormal looking stools. I found a study that was interesting. They looked at testing Candida IgG antibodies in children that were diagnosed with autism. So, thankfully, we have these wonderful researchers who are making these connections as well, and they're trying to show that there is a connection. And so we know that the microbiome significantly influences neurodevelopment and behavior, okay? And we see also that immune dysfunction and GI distress are very common in children with autism. So they were seeing that dysbiosis is common, and the Candida albicans antibodies were also common in children with autism. And it doesn't always equate to the symptoms they're having. So that was something that I think, we need a good reminder of. So they found that there was also imbalances of their inflammatory cytokines, and that it didn't necessarily correlate with the child's GI symptoms. So in the children they found the high IgG Candida antibodies towards, it wasn't the ones who were necessarily having the worst problems with their gut. But this is also a good reminder to us that if we have a child come in and they're having these healthy looking stools, and parents are saying, well, they're not bloated, they're not in pain, they're pooping every day, that doesn't mean that their microbiome is in perfect condition either. Okay, so that's something to remember, that we still have to assess and know that we're doing well in that area. Low beneficial flora. So on the test that I use, the GI map, we're looking at beneficial flora, and then also compared to more opportunistic bacteria. And so you have the ability to look at the balance there. And oftentimes kids can come back with low beneficial flora. Maybe they've had a lot of antibiotics. Maybe their initial inoculation to flora was poor. Maybe they've been on a lot of antacids for reflux as a baby. And so this is going to affect motility. We can see constipation, we can see bloating and heartburn, and this can even lead to more autoimmune issues because we don't have enough beneficial flora in our body. Short chain fatty acids, these can be produced from our good flora, and we also get it from fiber in our diet. And so those are two things that we often see lacking, is fiber in a child's diet and beneficial flora. And so if we have low short chain fatty acids, we also can have motility issues, increased gut permeability, and more inflammation. And these are all things we can determine with that stool study. Parasites, who loves talking about parasites? Probably parents really get this wide-eyed, scared face when I tell them that their child tested positive for a parasite. But it is so common, and it's easy to get. I remind parents that our dogs, we treat them with antiparasitic medication every month. And it's because they're walking around barefoot, they're outside, they're licking stuff, they're eating things they shouldn't, but they're much like toddlers walking around, touching things, putting them in their mouth. So we're not immune to parasites. And often children can present with waking up a lot at night. They can tell you their bottom's itchy. You might see them kind of grabbing at their shorts throughout the day. We can see worsened behavior, irritability, anger. The full moon can be a trigger for them. So these are things, if you're noticing in your child, you might go, wait a minute, I wonder if they have a parasite. Clostridia, this has been studied pretty well in autism because having an abundance of this bacteria called Clostridia, and there's many, many species, but it has been shown to increase aggression, anger, self-harm, and it can negatively affect speech and language in the autistic child. So I pulled up a couple of studies I wanted to share. This one's from 2007. And they saw that children infected with parasites, they're going to be less active, their behavior is going to be sluggish, and their mental and physical activities and processes are dulled and slow. So you're seeing the connection between what's going on in the gut and what's happening in the brain there. This was a study done on Clostridia, and they found that the number of Clostridia species in autistic children was greater than neurotypical children, and that there was a correlation between the colonization of Clostridia and exacerbating ASD symptoms. And there were a lot of studies on this, but I didn't want to bore you guys with too much literature. Another thing we commonly see is an overgrowth of good flora, which you might think, well, what's the problem there? Can you have too much of a good thing? And we, for many years, I think we have taught and we have learned, okay, give a child a probiotic every day. If they're on an antibiotic, double the probiotic. We're grabbing at these very common probiotics off the shelves like Culturelle, Floristore. And now we know so much more about the microbiome. We know that not every probiotic is the same. We know that not every person needs the same probiotic. Everybody's flora and microbiome composition is so unique. And so if you are constantly feeding the same probiotics into your gut, you might have an overgrowth of that species. If you have a lack of the first defense in the gut, let's say you're stomach acid, you could have good flora overgrow because there's nothing inhibiting it. And so when it climbs up from the large to the small intestine, then that bacteria can actually ferment your food into gas, and that can cause bloating, of course, extra gas, diarrhea, constipation. So you might have heard of the term SIBO, small intestinal bacterial overgrowth. And that can be extremely common in children with autism. So how does diet contribute to this, and what do we see in our patients with autism? They often have a very limited diet, and I know a lot of my parents just get so frustrated that they cannot move them away from carbs. It's like they're living off of chicken nuggets, crackers, and macaroni and cheese. And as a parent, I know how frustrating that is. And no matter what they try, they seem to be addicted. They want their milk and they want their gluten. And what we're seeing is that there are opiate peptides in gluten and dairy that they have been able to see in children's urine that have been eating an abundance of these foods. And that causes a disruption in the neurotransmitter pathways of the gut and can affect behavior. So even though some children might not respond to a gluten and dairy-free diet, most of them do. It can be very beneficial to remove those foods from their diet. It can be beneficial to try and start including other foods, whether it be in a smoothie or hidden in food, but getting them other nutrients. a lot of times they're lacking in protein. And so they're on this blood sugar roller coaster where they're eating their food, they're eating their carbohydrates, and their blood sugar spikes, and then it comes down. And we will also often see behavioral issues with that blood sugar roller coaster. The milk consumption is a big thing too. And as parents, we're thinking, okay, they will drink milk. It's full of protein. They're getting some good nutrients that way. But milk is also blocking a lot of other good nutrients from entering the cell, like iron. So oftentimes my patients will come in and they have a good appetite. They're eating a lot of food, but it's not the right foods. It's a lot of nutrient deficient foods, and it's preventing them from getting the other nutrients into their cells. So how do we clean up what's going on? What are some things we can do? And these are things you can start thinking about if you're at home and you're wondering, what can I do for my child? One is we can remove gluten and dairy from the diet, just as we discussed. And a lot of families will need and do benefit from the help of a nutritionist when they're doing that, especially if they have never encountered removing foods from the diet. We can encourage eating real food and less processed food, which is definitely not an overnight thing. A lot of times it takes baby steps to go in that area, to go down that path and to conquer that. We want to encourage to keep sugar under 20 grams per day. A lot of these patients, they're eating quite a bit of processed food because that's all that they want, and the sugar content adds up. And then that sugar is feeding the negative microbes that we were just talking about, the Clostridia, the yeast, the parasites. And so it's like this catch-22 where, well, we want our child to eat, well, they're eating a lot of gluten and dairy and sugar, and then it's feeding the negative microbes, and we're seeing increased behaviors from that. We also want to encourage buying organic foods. We talked about how all of those environmental toxins can add up and really impact the brain and impact development. And then incorporating fermented foods slowly if we can get that into these kiddos, because that's what's going to help feed the more beneficial microbes. Other small things we can do in our home: we can switch to filtered water. We can get a good filtration system. I love Berkey. Aquasana makes good filtration systems. You can get a whole house RO system if that's in your budget. We also want to try and assess the microbial composition with a stool study if you have access to that, if you have a practitioner that can help you and guide you, because that is the best way we're going to know what is going on and what is right for your child. We want to avoid antibiotics when possible and not overuse them, which is still very common. Even in some of my patients, they will get an ear infection and immediately be put on an antibiotic. And now the literature is saying, well, you can watch and wait, if the symptoms are mild. And so we do have to consider, is this absolutely needed? Because the detriment from that antibiotic can take a while to clean up. And if you guys, I don't know if you missed, we did a webinar a couple months ago on restoring the microbiome after antibiotics. And hopefully we will be able to release that soon because it was recorded, but that one was really great, talking about post-antibiotic gut support. We do want to avoid pesticides and other common toxins. One of the things that I try to talk to my families about is their toxic burden in their house. What are they cleaning with? What are you using in your laundry? What kind of cookware do you have? What are you putting on your child's body? And all of these chemicals add up. And now we are learning so much more about all of these chemicals and the impact that it has on autoimmune disease and on cancer, et cetera. So there's just simple little ways you can start to clean up your home, and that will benefit your child for the rest of their life. So I wanted to include a few supplements that I love and that I use pretty often. Now, this is not all inclusive, of course, and depending on what the child shows on their stool study, we will use other things, other herbs, possibly medications if we need them. But I want to point out a few of these because they are so wonderful. The first one is the Nerali probiotic. This is a newer probiotic. It has the strain, the Lactobacillus plantarum strain PS128, and it's considered a psychobiotic. And they have done research on this probiotic for autism and for depression and anxiety, and the results have been really amazing. And I can tell you clinically, almost all of the patients that I have advised being on this probiotic have done really amazing, and we have seen outstanding improvements. So that is something that is really encouraging. The second product is the Ultra GI Replenish, and that is considered a medical food. It is a protein powder with a vitamin and mineral complex and an amino acid complex. So it's a wonderful thing to include in a smoothie. It has just lost my train of thought. It has prebiotic complex, and it is really beneficial for beefing up the good flora. So if you have a child that is having issues with motility, constipation, potentially low beneficial flora, this could be really game-changing for them. And then neuronutrients balanced gut support. This is another one of my big time favorites. And I talked about this one in the antibiotic webinar. It has a combination of colostrum, which can help rebuild the intestinal lining, lower inflammation, bind to unwanted pathogens, and it also has prebiotic fiber in it. So not only are you decreasing inflammation, you're also feeding beneficial flora and just, rebalancing the gut altogether. So it's been a great product. And then on the far right is our Therabiotic Saccharomyces boulardii. And so this company previously was called Claire Labs. Now they're SFI Health. But Saccharomyces boulardii is a wonderful boost for the immune system. It can help with yeast, decreasing yeast and preventing it from replicating. Can help with constipation. See a lot of good things with Saccharomyces. It's actually a beneficial yeast strain. So it sounds kind of funny that you would use it for yeast, but it crowds out more negative yeast. So these are 4 of my favorite products right now. And then really, want to encourage families, if you can, to join the gut program in April. It's April now. It's starting next week. This will be a 3-part series that will include a longer lecture on the gut. We're really going to dive into the history, dive into all the species, learn extensively about the gut, and dive into a stool study for your child. So you can learn, okay, how can I start to help my kiddo if they are or if they aren't having GI symptoms. Remember, not every kid is going to have GI symptoms, but their gut might be a mess. So join the gut program. We will have a link for you guys. I'll make sure that you get one if you don't have it. It's on our website as well. But that will be really fun.